I'm Brandon Jessup from Michigan Forward. We'd like to thank DYP for always working with us on these events, and also the AARP and Michigan Nurses Association for joining us for this very important topic on healthcare reform. For Michigan Forward, we know that healthcare reform is a huge issue on our plate. Is how it ties into the state's economics, how it ties into businesses and their bottom line, but more importantly, it's about the social good, the public good for all Americans. So without too much ado, I'll first start with Ms. Felicia Watson, who I met about 2 years ago. She was working with St. John's Ascension Health at the time, and now she found herself at AARP. I still don't think she's a retired person or aged person, but nonetheless, she's here representing AARP as their Associate State Director for Government Affairs. So first, Ms. Watson.
Thank you for having me.
And then to her right, we have Ms. Julie Ann Barton from the Michigan Nurses Association, the largest
nurses union in the state of Michigan. We represent registered nurses, over 10,000 nurses.
And my mom was one of those 10,000 too. But and Julie comes to us from a long line of union organizing from the UAW to the United Steelworkers, and also the servers, the SEIU, are good friends all across the country. So to add a little bit of more purpose to why we're here today, we've heard plenty about healthcare, the issue, what it is, and the turmoil around it, or the confusion around it. We, as Citizen Michigan Forward and Detroit Young Professionals, today we want to really dive into why is this issue such an important issue for us. And then we also want to encourage your questions, your foresight and insight into what healthcare reform should look like. This is what these forums are about, to add your input. And then also, we want to touch a little bit into President Obama's plan.
AARP is the nation's largest membership organization representing the interests of those age 50 and older. And many people are, wondering why is AARP involved. We've taken a pretty large stance that we are in favor of healthcare reform, and as a result have taken a lot of hits in the media publicly about our stance on healthcare reform. And AARP believes that healthcare reform is absolutely necessary. Our involvement is for the interest of all of our members, those aged 50 to 64 who are not quite on Medicare yet, and those 65 and older who are on Medicare. Although those two groups of people have different issues related to their health care, it is imperative we feel that AARP be at the table and demand that certain things be included in any health care reform legislation. So I'd like to first say that AARP has not endorsed any piece of legislation, whether it be the President's proposal, the House proposal, or the Senate proposal. We're a nonpartisan organization, and we try diligently to stay in the middle of the road, for lack of a better term, to come up with what's right for our members and not what's political. We will probably in the end up endorsing a bill should it include all the items that we're looking for, but currently we have not endorsed a bill. So when people come and say, well, you're supporting President Obama, and no, we support health care reform. AARP wants to ensure that Medicare is protected. I know many of you, I know my parents are getting ready to go into Medicare at 65 next year. We want to ensure that Medicare remains the same. The President has proposed significant changes in Medicare, and many are really concerned that those changes mean cuts in benefits to Medicare. AARP will not endorse any product that takes away benefits from Medicare beneficiaries. We believe that no one should come in between you and your health care. We've heard a lot about death panels and bureaucrats, and someone else is going to be in charge of your health care. And we've been, as an organization, put to the test. Why would you support a bill that does that? Exactly, we wouldn't. We would not support a bill that allowed for the government to make decisions that have to do with the family's choices for their family. We want to make sure that we protect consumers. We want to make sure that your consumers' interests are put forward ahead of those of the insurance companies. Preventing discrimination. Currently, health providers can charge higher rates based on your age. It's called age rating, and we want to fight against age rating to make sure that those elderly people do not pay up to 5 times more than those younger than them.
Speaking from the nurses organization, because we do represent 10,000 nurses throughout Michigan, nurses directly see the impact of patients who come into the healthcare system that have not had any healthcare coverage for many years. And I'm sure that many of you, as you look around the city of Detroit, our healthcare was directly linked to our jobs. And as the jobs continue to leave the city, therefore goes our health care. So Michigan Nurses Association and United American Nurses does support President Obama's plan as it was introduced. To highlight a couple of the main issues that are, not that they're all not important, but the main issues that are directly impacting nurses that Obama's plan covers is the not cutting people off for pre-existing conditions and the things that are built in for preventive medicine. You know, maybe 10 years ago, if a nurse had 5 patients, it could have been manageable. Maybe even 7 patients could have been manageable. But now, with so many Americans not having health care, when they hit the hospital door, they're so much sicker. The acuity levels make it harder and harder for nurses to, really give the holistic care. The education. Like if you are a grandparent and you live with your granddaughter and the nurse isn't there to explain to your granddaughter that, insulin shots are to be given at such and such time, this is what a diet looks like, this is what all this medication, they go back outside, they're discharged, and then without that education, they're back in the hospital, which creates more of a cost to the whole system.
But what's on the table here in Michigan is always on the mind of Michigan Forward. And as we look at right now a possible state shutdown with budget conversations and things like that going on for next year, and also, Julie, you brought on the job and the healthcare link. Michigan has far more people now needing healthcare, cannot afford COBRA, or they may or may not have access to Medicare here in the state of Michigan. So now we're looking at an infrastructural problem. The United States is the 3rd largest country in the world, behind China and India. Our healthcare system has not been modified since 1947.
Michigan is unique, and I don't know if a lot of people know this, and I learned this too. Michigan is unique in that we have Blue Cross. And Blue Cross is called the insurer of last resort. By law, Blue Cross has to take all comers. Other states have some different configurations, like a risk pool where they put lots of different people pooled together to try to bring down the cost of health insurance. But in Michigan, we're unique because we have Blue Cross. And I've talked to some people in some other states and said that we're really lucky that we have an insurer of last resort that has to take all comers. But if they take all comers, it's great, but if you can't afford it, it's useless. So there are some changes in our marketplace that have to happen to ensure that, yes, while we have insurance available, people can't afford it. So that's a tug and pull that we're going through, even here in Michigan on the state level, about what does that look like. Blue Cross would say, my friends, we've been on opposite sides of the aisle a lot over the past year, but they would say that they need some assistance because they can't continue to take, be the only person who is burdened with taking all comers. Other insurance companies don't have to take